When it comes to men's health, testosterone, also known as the male hormone, is crucial. It's the hormone that causes adolescent boys to acquire stereotypically masculine traits, including thicker hair, a deeper voice, and larger muscles. The significance, however, extends much beyond these outward manifestations. A healthy sex drive, energy levels, muscular growth, emotional regulation, and strength are all supported by testosterone. Keep it in mind as the engine that keeps your mind and body going strong. Testosterone levels naturally fall in males as they become older. A precipitous decline, however, may cause a host of health problems. If you want to take charge of your health and fix any imbalances, you need to know how important testosterone is. You may improve your health and quality of life by optimizing your hormone levels and learning to recognize the signs of low testosterone and getting medical help when needed. When your testosterone levels are low, it may affect your mental and physical health in many ways. This illness is more frequent than people know and may afflict men of all ages. While some men may encounter mild changes, others could notice more dramatic symptoms that might profoundly impair their everyday life. One of the most typical indicators is prolonged exhaustion and poor energy levels, even after obtaining enough sleep. This might make it challenging to remain productive and focused throughout the day. You could find it tougher to get through the day or feel less inspired to participate in physical activities you formerly loved, such as exercising or engaging in sports. Changes in mood and emotional well-being are also prevalent with low T. These changes might also be confused for other mental health disorders. You may suffer increased irritation, mood fluctuations, or feelings of melancholy and despair. These emotional shifts hinder relationships and influence your general quality of life. Decreased muscular mass and increasing body fat are some clear indications. These bodily changes may be upsetting and influence your self-worth. If you observe any of these symptoms, it's crucial to check with your healthcare professional to establish the underlying problem. They may do tests to detect low T and prescribe suitable remedies. Early identification and therapy may make a major difference in treating low T and recovering your vigor. Taking action may help you restore your energy, boost your mood, and increase your general wellness. Your lifestyle choices play a key influence in maintaining appropriate testosterone levels. What you eat, how much you exercise, and the quality of your sleep may all impact your body's production of this vital hormone. A balanced diet consisting in lean proteins, healthy fats, and complex carbs offers the building blocks for testosterone synthesis. Regular exercise, especially strength training, is a significant testosterone booster, boosting blood flow and promoting hormone release. On the other side, persistent stress, poor sleep, and excessive alcohol intake may all adversely affect testosterone levels. By adopting modest but powerful lifestyle modifications, you may create an atmosphere that promotes healthy hormone balance. If you feel you may have low testosterone, there are a few options to receive an initial screening before contacting a doctor. It's always excellent to be knowledgeable about your health and take preventative actions. Home testosterone test kits are widely accessible online and at most pharmacies, giving a handy option to assess your levels from the comfort of your home. These kits are meant to be user-friendly and may give you a basic indication of where your testosterone levels stand. These tests normally entail a simple saliva sample, and findings are usually available within a few days. The technique is easy. Collect your sample, submit it to the lab, and wait for your findings. While home tests may be useful indications, it's essential to understand that they may not be as reliable as laboratory testing administered by your healthcare practitioner. Home testing may occasionally offer you a false feeling of security or undue stress. Another technique to assess your testosterone levels is to pay attention to physical changes in your body. Your body frequently provides you indications when something is awry. Have you observed a loss in muscle mass, which might be a symptom of decreasing testosterone levels? And rise in body fat, especially around the belly, which is another prominent sign, or a decline in your sex desire. These symptoms may greatly influence your quality of life. While these changes may be ascribed to numerous sources, they can suggest a hormonal imbalance. It's vital to evaluate all areas of your health. If you're worried about any physical changes, it's essential to check with your doctor for a full assessment. A healthcare practitioner may offer a more accurate diagnosis and propose suitable treatment alternatives. While home testing and self-monitoring might give some insights, contacting a healthcare expert is crucial for correct diagnosis and treatment of low testosterone. A doctor may order a blood test, which is the most accurate approach to evaluate testosterone levels. They'll also investigate your medical history, lifestyle variables, and any other symptoms you're having to establish the underlying reason of your low T. Remember, low testosterone may sometimes be a sign of an underlying medical issue such as hypogonadism, a disease where the body doesn't make enough testosterone. A doctor can discover and treat any underlying health conditions leading to your low T. They may also propose the best suited treatment strategy, which may include lifestyle improvements, testosterone replacement treatment, or treating any underlying medical issues. Understanding your testosterone levels. Once you've had your testosterone levels examined, your doctor will help you comprehend the findings and what they indicate for your health. Testosterone levels are measured measured in nanograms per deciliter. A normal range for adult males is normally between 300 and 1,000 nanograms per deciliter. However, it's crucial to remember that what's deemed normal might vary significantly based on your age, general health, and the individual laboratory that did the test. If your testosterone levels fall below the usual range, your doctor will assess your unique circumstances, such as your age, symptoms, and general health, to assess whether therapy is required. They'll also take into consideration any underlying medical disorders that could be contributing to your low testosterone may be caused by a multitude of causes ranging from underlying medical issues to lifestyle choices. One of the most prevalent reasons is hypogonadism, a disorder when the testicles don't make enough testosterone. This may be due to difficulties with the testicles themselves or with the pituitary gland in the brain, which sends signals to the testicles to create testosterone. Other medical disorders like obesity, type 2 diabetes, and obstructive sleep apnea may also contribute to low T. Certain drugs like opioid painkillers and certain antidepressants may also interfere with testosterone production. Lifestyle variables include chronic stress, lack of sleep, excessive alcohol intake, and a sedentary lifestyle may all severely impair your body's capacity to create testosterone. If you're diagnosed with low testosterone, your doctor can propose lifestyle modifications as a first-line strategy to raising your levels organically. These adjustments typically go hand in hand with other therapies and may greatly improve your overall health and well-being. One of the most efficient methods to naturally enhance testosterone is via regular exercise, particularly strength training and high-intensity interval training, or HIIT. These forms of exercise have been demonstrated to enhance testosterone levels and improve insulin sensitivity, which may further assist hormone balance. Maintaining a healthy weight is vital, since obesity is related to reduced testosterone levels. Aim for a balanced diet rich in lean proteins, healthy fats, fruits and vegetables. Vegetables and whole grains minimize processed meals, fizzy beverages, and unhealthy fats, since they might significantly alter hormone synthesis. If lifestyle alterations alone aren't enough to enhance your testosterone levels, your doctor could offer additional treatment choices including testosterone replacement therapy, or TRT. This is typically explored when other treatments such as diet and exercise have not provided the intended outcomes. TRT includes boosting your body's natural testosterone production with synthetic testosterone. This may help restore hormonal balance and promote overall wellness. This may be delivered by injections, patches, gels, or pellets inserted beneath the skin. Each treatment has its own set of benefits and possible negative effects, which should be addressed with your healthcare physician. TRT may help improve symptoms of low T, such as poor libido, exhaustion, and diminished muscle mass. Many people report feeling more energized and enjoying enhanced mood and physical performance. It's TRT with your doctor to evaluate whether it's the correct solution for you. Your doctor will examine your medical history and current health state before making a suggestion. In certain circumstances, your doctor may suggest treating underlying medical disorders that might be contributing to your low T factors, including obesity, diabetes, and thyroid difficulties can all play a role. For example, treating sleep apnea with a CPAP machine may considerably enhance testosterone levels in males with the illness. Proper sleep is vital for hormone control. Additionally, your doctor could prescribe treatment or counseling to help you manage stress, anxiety, or sadness, which can all adversely affect testosterone production. Mental health is a vital part of overall well-being and may impact physical health in various ways. Navigating the world of low testosterone might seem daunting at times, but remember that you're not alone. Your healthcare practitioner is your valued partner in your journey, giving direction, support, and specialized treatment regimens suited to your unique requirements. Don't hesitate to ask questions, voice your concerns, and actively engage in choices involving your health. Open communication with your doctor is vital for obtaining the greatest potential results. Remember that testosterone levels might change, and it could take some time to discover the ideal treatment strategy that works for you. Be patient, be educated, and establish an open line of contact with your healthcare staff. Your testosterone levels play a key part in your general health and well-being, impacting everything from your energy levels and muscle mass to your mood and sex drive. By knowing the variables that might impact testosterone production, identifying the indications of low T, and adopting a proactive approach to your health, you can optimize your hormone balance and live a happier, more meaningful life. Remember, knowledge is power. By being educated, receiving prompt medical advice, and adopting healthy lifestyle adjustments, you can take control of your testosterone levels and experience the vigor and well-being you deserve.
Looking for high-quality supplements backed by Dr. Andrew Huberman himself? Check out the links in the description below and subscribe and hit the bell icon if you've learned anything new or anything of value.